Please welcome this boy, Hussein Dedić, and his mommy, Mrs. Mujezira Dedić. Welcome here. Here's another boy, Dino. You've got company now. Please take your seats, make yourselves comfortable. Hussein had problems with his vision. When did his problems occur? He was born with this problem. His eyes weren't as alert as the eyes of my eldest son. When he was 3 months old, I noticed that he didn't follow my movements at all. Then I went to see a pediatrician. The pediatrician directed us to Tuzla, and I spent 11 days in hospital there with my baby. They took blood from his head, and they did everything to find the cause, but they couldn't find anything. However, when I took my eldest son to the doctors that day, I asked for a reference slip for him, and I found that my eldest son, who was 3.5 years old, also had a problem. Well, what was his vision like when he was 3.5 years old? Could he see anything at all? Well, yes, he could, and we couldn't do much there, just as we hadn't been able to do much with my youngest son. And my youngest son didn't follow my movements at all. With my younger son, he was a 3-month-old baby. Then I started seeking help in Tuzla. This lasted for 3 years. He wore glasses for 1 year. In 2008, he was operated on. The operation lasted for 1 hour and 40 minutes. They took him out of the operation room and they woke him up. They said they'd found a small dot. They didn't know what the small dot was, but they said they'd monitor it. However, he had many control examinations. He wore glasses for 3 months. Then I took him to a control examination, and they told us to come again in 2 months and that he should continue to wear glasses. But for 1 year, I asked whether the child would change glasses or would permanently wear the same ones with the diopter value of -10, while the youngest son had a diopter value of -15, and he had been wearing such glasses as a 1.5-year-old baby. And so I gradually started to realize, and in June this year I became fully aware that this would bring no results. I also tried in Ljubljana and in Zagreb, everywhere, until I realized that control examinations were performed at intervals of 1 to 2 months, and I didn't like that at all. When you were in Ljubljana, Zagreb, you heard numerous opinions of doctors. Did they tell you that one day everything would be all right with your children's vision? What did they tell you in particular? Nothing, simply nothing. We took him to control examinations. I also observe all the movements of my children. I observe how my son moves, whether he waves to me if I make a movement with my head. He's better now, he's healthier. He used to be robust, but he's more robust now. Therefore, it's owing to his eyes. He eats better now, the child can see. He keeps asking questions about those things which he couldn't see earlier, but which he examines now. I used to make appointments with doctors until I found the information about Sveti on the internet, and I called them. As early as the following week, they called me back and told me to bring my children for examination. They asked me if I sent them all the findings gathered during those 3 years in Tuzla. In Belgrade, they examined all these findings and said that if that was the real situation, they were going to make their own control examination. What did they tell you in Sveti when you went there? Well, we came there and they told me that my children had to undergo surgery. This was a shock to me, as I had to find money somehow to save my children. This tells us that you're a very good mother, that all this, I can't stop, I'm going further. If it's not financially feasible, I want to thank a lot to people who have helped my children and prevented a complete loss of their vision. This is all I can say, and my children won't become blind, not here in Belgrade. I won't stop. I may imagine how you felt when they told you that both your sons have the same diagnosis and that they can't see properly. It's still hard. My younger son has to undergo more operations, but I can't stop. I'm going further, and I don't want to change the institution. I'll continue the way I've started, non-stop. I believe that you'll succeed and that your sons will be able to see. I hope so. Great. I've noticed I've noticed that my children feel better now, that they can see better. So when you went to Belgrade, to Sveti with your little son, who is sulky now here in our studio, they told you that he had to be operated on. Yes, he was at an examination, and the doctor went out and said the surgery had to be continued. However, he came around after 3 to 4 hours. I returned home. And so it's been already the second week now since he was operated on. Not cataract, but that pellicle. Scleroplastic implant was incorporated. There's been 2 weeks since then. So he's been operated on recently. Yes, this is why he's a bit... Then we understand him, and he's so cute.
Onda ga razumijemo tako, a presladak je.
Tell me, what did your son say after those operations? Did he feel any change in his eyes? Well, he did. There's a mosque and a house at some distance from our house, but he couldn't see them earlier. And he showed me the houses all the way, all that he could see. Just like that. Great. Are any additional operations required, or he has finished with it? Well, they told me that he'll have regular control examinations.
Jesu li potrebne još neke operacije ili završio s tim?
Pa rekao se da je sad završio kontrole, da će ići redovno na kontrole.
Ide li u školu?
Does he go to school? He's in the first grade. And how does he manage it? Well, it's good. Can he see well? Yes, he can. This is the most important thing. Thank you very much. I think we should explain to our spectators how the cataract problem can be solved. How is the cataract problem solved in children, and how is it solved in adults? Is there any difference? There is. There's a great difference. In one of the shows, I said the pediatric ophthalmology problems can't be compared to adult ophthalmology problems. In children, there are specific requirements. Problems are various, and you should react quickly. We don't have much time here. What we have to do is to notice the problem timely and try to restore as much of visual potential as possible, to use that potential until the child starts going to school. Therefore, our reaction should come in a situation where cataract is visible, if it's evident upon birth or immediately after birth. When cataract is noticed, a reaction should come immediately. We can see from practice that mothers are the best doctors to their children. Pediatric problems somehow burden you because you must have in mind all the possibilities that may arise later in life. It's not only about solving cataract for the time being and finishing with it in that way. No, it's just the beginning for us. Therefore, by doing this, we free the visual axis and we give the eye a possibility to receive light, to let the light through the retina. But during the years to come, our task is to determine the way the image is to be formed, to be sharpened, and we are obliged to monitor the child. Cataract surgery can be performed in very young children at only 1 or 2 months of age, when the visual axis is completely blurred, when there's no possibility for light to get into the child's eye. If cataract is minimal, as it is in Ivana's case, the operation can be performed later. Therefore, with these boys, we had to react immediately, and we implanted lenses, adequate small lenses. In certain interventions in child, and we implanted lenses, adequate small lenses. In certain interventions in child, as at the same time there's the posterior capsular blur, colloquially often called secondary. A skillful surgeon can solve this simultaneously with cataract in one action, thus enabling the visual axis to stay open. The child receives lenses and visual development is monitored. A frequent misconception among people, and even among ophthalmologists who don't deal with pediatric problems, is that a lens shouldn't be implanted in the child. Nowadays, Nowadays, this misconception is maybe somewhat less expressed, but it still exists. Most doctors don't implant lenses, but it's absurd. You remove cataract, the child can't see sharply, there's no correction, and blurred vision remains. We talked about this in previous shows. Therefore, a lens must be implanted, and as the eye grows, it continues growing normally, and you monitor the development of diopter values. The diopter value can't be enormous, plus 14, as the lens is accurately calculated, and it's selected according to the age. It isn't all the same whether you have a baby who is 2 years, 1 year, or only 6 months of age. In the world, it's been precisely defined how and which diopter value is determined in order to enable adequate vision at that age and to be able to correct any possible increase in the diopter value afterwards. This may happen in younger children, while in older children this change will be less prominent until 8 years of age. What do I mean? The situation requires further control examinations after a month, 3 months, or 6 months. Then, as the child grows, control examinations are performed at 1-year intervals. In some situations, we find that cataract may have a tendency to prevent the eye from growing. You have a myopic eye until 8 years of age. What do I mean? The situation requires further control examinations after a month, 3 months, or 6 months. Then, as the child grows, control examinations are performed at 1-year intervals. In some situations, we find that cataract may have a tendency to prevent the eye from growing. You have a myopic eye in this case. In this case, you have an eye that tends to be myopic. When this is noticed, we perform a scleroplastic operation. This was performed in little Hussein just in time. So the cataract surgery was performed when he was very young, and the scleroplastic operation was performed recently. He started going to school, and we have stopped further increase of the diopter value. Of course, if necessary, correction will be performed. Laser diopter correction may also be taken into consideration. Therefore, there's no change. What's important is that there's no replacement of the eye lens, as I'm frequently asked what we do with that lens later when the eye grows and the diopter value changes. There's no need to change the lens. The diopter value can't change so much, but if it increases, there's laser correction. It can be applied like in all other children with diopter problems. In these cases, we'll also apply laser at an adequate age so that these children can have sharp vision at any time.